Welcome to Beyond the Shift Talk Show. I am your host, Grace Wanjohi. I want us to discuss about breaking bad news to people who are affected by either loss, through disaster, through death, through loss of health. As people in helping professions, how do we break this news to our clients? Breaking bad news needs a special skill for the clinicians or the person delivering the news. Research has shown that interpersonal communication is a core competence for people in helping professions, especially in the healthcare setting, because this is what helps you engage with your clients or the patients and build therapeutic relationships. However, sometimes this communication is affected by limited time, limited resources, and even training. How a person is trained in communicating with their client or their patient sometimes affects this creation of a therapeutic relationship. Frontline workers, this could be psychologists, this could be the people in the healthcare profession, are usually required to break bad news to people, to family members, about diverse losses. Not just the loss of life, loss of property, loss of a function, loss of health. So how do we go about this? Remember, when you break this bad news, the attitude, the choice of words will be remembered by the bereaved person or the affected person for a long time. And the way you break the news might affect the way they process the news. So it is good to choose your words carefully. It is good to choose the setting carefully so that even as you deliver the news helps this person to move to the next stage. It has been established that this is rarely taught in basic training, and especially in the health care setting. So people who break news, the doctors or other healthcare workers, usually use their own experience or what they have seen their seniors do, maybe during the training or in the field. So today I want us to look at a simple way of breaking this news. There are many ways, but I've adopted one that is summarized as SPIKES, S-P-I-K-E-S, to guide people on how to break news. So welcome on board and let's learn together. S stands for setting. When you are breaking bad news, look for a nice setting, away from many people, and if possible, have 2 or 3 people that you're going to break the news to, so that in a family setup, people can identify 2 or 3 people that can get the news and deliver it to the rest of the family. It is very hard to handle a big crowd, especially when you are delivering news of loss. Invite 2 or 3 people and let it be a quiet place, away from distractions, where everyone feels safe, the helper and the recipient of the news. P stands for perception. Once you're seated, ask or inquire from the people you are delivering the news to how much they know about the situation. If it is a medical illness, let's say, for example, it's a terminal illness and you want to tell these people, or the patient is not doing well, they are going down and you can see they are not responding well to treatment. So find out from the people you are giving the news to, the family members, the significant others, how much do they know about the patient's situation? If it is a death, how much do they know about this? How did they learn about the news, assuming they're coming to you after they have learned about the loss. Or when they were called, how did they receive that news? What are they thinking? What are they thinking about being called at the hospital, maybe late at night, maybe very early in the morning? So I represent invitation. Obtain the permission to continue. Once you have identified what they know about this situation, ask for their permission to continue. Can I continue? Can I give you the news for which you are called? Can I tell you what this means for you as a loved one? Do not just go and start talking. The next one is K. K stands for knowledge. Give the information gradually, little by little, and as you give the information, check for comprehension, check for understanding. Are they understanding what it means? Maybe this is a diagnosis about a terminal illness. Do they understand what this means? Do they understand the journey? Do they understand the possible outcomes? Do they understand the possible methods of treatment concerning this particular disease? If it is loss, do they understand how this death happened? Maybe they knew the condition was terminal, but they want to understand what happened, what eventually happened. Did the heart fail? Did the brain fail? Did the kidneys fail? This is what we are calling giving information and checking for comprehension. Next is E. E stands for emotions. Allow for free flow of emotions. Allow your recipients of the information you're giving to react emotionally. Some may cry, some may scream, some may just be quiet, some become numb. Allow them to react in the way that they choose to react. And finally, S is for summary. Allow questions at this point. Summarize what you have said. Allow them to ask any question that they may have. And also plan, strategize. What is the next step? If it is diagnosis of a terminal illness, it could also be an acute illness, but they want to understand what is the next step. This is where we are. This is the current situation. How do we move forward? Either to the treatment. If it is loss of life, what is the next step? Where do we take the body? How do we preserve the body? What are the next steps? Are we going to get any documents? What are the charges? At this point, this is where you summarize the entire conversation that you have had with your significant others or the loved ones of the patient, and plan ahead. So there are many types of breaking news. I have just chosen to use spikes because I find it easy to follow, and it makes the process easier even for the person breaking the news. So as people in helping professions, I know it is not easy. I'm yet to find a person who says that breaking bad news is easy for them. But this is one of the ways in which we can break news to people who have been affected by a loss, whatever form of loss. May it be a relationship, may it be a loss of function, a terminal illness, or the loss of a loved one, the death of a loved one. So let us learn. It's never easy for anyone. It's not also easy for me, but this is something that has been designed to make the process easier. So until the next talk show, I have been your host, Grace Wanjohi. Thank you and bye-bye.